Sorry. So my name's Chris Rain. I work for 360 Edge, heading up their partnerships. Today, we're really focusing on evaluation. And I think this is why it's so interesting for a lot of people across PHNs is it's a really critical area for improvement in the work that we do. And there's some key challenges that we have to overcome. Today, we've got Professor Nicole Lee and Dr. Amanda Davies from 360 Edge sharing some insights that we've kind of uncovered through the work that we've done. And then we also have Jill Yearsley from the Northern Territory PHN, the CEO there, and Jill Smith, the CEO of CAPS in Northern Territory too. So it would be great to get your questions. We're going to have a quick conversation with Nicole, then Amanda, then we're going to have a panel with the two Jills spelled differently, and then open up to questions, and we'll invite anyone that has a question. We have plenty of time for discussion following that. So thank you everyone for joining. It's great to see over 30 people from across the country join us, and yeah, we hope this is of value. We'll send an evaluation after. So over to you, Nicole.
Great. Welcome everyone, and thanks for joining us. I just thought I'd quickly introduce 360 Edge. So some of you we know very well, and some of you might not know us that well. We are a consultancy that works in across alcohol and drugs and mental health and allied areas, including justice and education, a range of sectors. And we basically have 4 interlinked programs: workforce development, service improvement, program evaluation, and systems development, plus a workplace alcohol and other drug policy program for industry. And so we are going to be talking about generally about evaluation, but we've got an example from one of our somewhere that sits between our program evaluation and service improvement programs in the Northern Territory, which I will hand over to shortly. But first, I just wanted to say a couple of things about evaluation and why it's so important, I guess. I think as the saying goes, you can't manage what you can't measure, what you don't measure. And to be really very blunt, as I am prone to be, there is really no value in funding a public health program that doesn't work. It's just a waste of money. So we want to really make sure that that the things that are being funded from all sources are actually effective and are doing what we expected them to do. So the other thing is that kind of what's worse, I suppose, is that we also know from decades of research that sometimes the best intentioned programs actually do harm. So they may intuitively seem great, but they either don't have the impact we're expecting, or they actually have the opposite impact. So I'm thinking about many of the drug education programs in schools that when they were eventually evaluated after being implemented for a very long time, many of them had been shown at best to be ineffective and at worst to actually increase interest in drugs, even though they seemed really very good on the surface, on face value. And that actually includes the very well-known Harold that many of us were subjected to at school, that still has a lack of evidence for the support to support it. So I think it's really critical not only to evaluate programs like these alcohol and drug programs that are being implemented, but ideally build that evaluation in from the beginning, because once the programs are established, it's very, very hard to move them on. And if you don't monitor outcomes, really at best you're wasting money, but at worst you could be making things worse, and I don't think any of us want that. It just makes me kind of think about it was a kind of fairly major, I'm going to say experiment, which turned out really well, but it's an experiment at the time in the UK, in the National Health Service, the NHS, and it was called IAPT. That stands for Increasing Access to Psychological Treatments. And what they did was require every publicly funded mental health service to implement a set of basic outcome measures, and they actually publish those measures on a website by service. So the general public could see this and they could actually make an informed choice about where to go based on the outcomes of that service. And over a very short period of time, everyone's outcomes improved out of sight, but particularly the bottom performing services moved much closer to the middle of the pack. So there's nothing like accountability to improve service provision. I think it was pretty confronting for the services at first, but in the end, the evaluation of the evaluation implementation was showed that it was very, very successful. And I think really every service provider, I really believe, should and does want to know what they're doing is effective, and evaluation that's clinically relevant allows us to do that. So not just funders, but the services, practitioners and clients can all be confident that what's being delivered actually works, not something that just sounds good or feels good. So that's enough from me, but I am really delighted to hand over to Amanda Davies, who's going to be giving us an example of evaluation of the CAP service in the Northern Territory. And before we nabbed her, she was with the Northern Territory PHN. She's worked in the sector for a very long time in service provider roles and as well as funder and now as a consultant. So she's got a really great perspective, like a 360 perspective, dare I say, of the sector. So over to you, Amanda.
Thanks, Nicole, for that lovely introduction and a really great setting the scene for evaluation work. My name's Amanda Davies. I'm a senior consultant at 360 Edge, and I'm delighted to have the opportunity to talk about two of our evaluation projects with CAPS. CAPS is an Aboriginal corporation, Council for Aboriginal Alcohol Programs, based in Darwin in the Northern Territory. It's been running for a really, really long time, and we've had the recent opportunity to work on evaluating two of their programs. So we're currently working on the Healthy Families program, which is a residential treatment program for Aboriginal people and their families. It's commissioned by NIA, the National Indigenous Australians Agency, but CAPS and NTPHN have recently partnered to fund an evaluation. The program is coming up for recommissioning 30 June next year, and it seemed like a really important time. We probably can ask Jill Smith from CAPS about her decision making around that. I think really the interesting point is that NTPHN are contributing quite a lot of funds to this evaluation, but they don't actually commission this program. And probably worth a question to Jill Yearsley about her decision making around that. But we know that the findings of this evaluation that we're doing will have implications for doing treatment work with Aboriginal people both in the Northern Territory and probably nationally as well. Excuse me. The Youth Services Program is an evaluation that we completed earlier this year. It's a revised program, and it's moved into being a flexible, non-residential and residential program. It's both needs and strength-based. It's co-commissioned by the Department of Health, Northern Territory Government and NTPHN. So for the 2-year pilot funding, there was an evaluation included as part of that funding to see whether the implementation of the program was going well and to help hopefully support the ongoing sustainability of the program. We're going to use these two examples to kind of demonstrate the importance and the challenges around doing evaluations for service providers in terms of systems, in terms of funding, and in terms of we're operating in an environment where it's really important for services to be able to justify their funding and prove that they are doing and having the treatment outcomes for their service users that they say they are. So I'm just going to talk a little bit about what we did with the Youth Services Program evaluation. We undertook quite an extensive gap and map analysis. We looked at program data and program documentation, which included things like compliance reporting, treatment frameworks, cultural safety frameworks, staff induction manuals, and the implementation plan. We undertook a series of consultations with CAP's leadership and staff. We also consulted with external stakeholders that included people who refer into the service and collaborating care partners. And we undertook some consultations with members of the Cultural Advisory Group. And then we mapped all of that data across key program areas that included key decision-making time points, intake, screening, assessment, discharge planning, and aftercare planning. We also looked at the barriers and enablers to implementing the new program. So what was happening in the internal systems, processes and procedures that were either supporting the new program implementation or inhibiting the program implementation. And then we developed a monitoring framework. So we knew from the beginning that CAPS really wanted to develop their capacity to undertake monitoring work for themselves. So based on all of the data that we'd analysed, we developed a monitoring framework that used a program logic approach, which you may have heard about. And it's a really useful approach of looking at all the causal relationships that happen within a program. So activities, inputs, outputs, and outcomes. So I'm just catching up with my notes. And so we compiled all of those evaluation findings into a summary report, and on that basis we made 3 key recommendations. So our 3 recommendations were to further develop a model of care, which is unusual practice for a new program. So it's a fluid process, a fluid document. We also thought that it would be helpful to support staff working in the new program to use that new model of care as a reference for them to do that work, because everyone was playing a little bit of catch up with the new program. We also recommended that CAPS implement the evaluation framework that we had developed, and that would help CAPS be able to more systematically and routinely monitor and evaluate their services on a day-to-day basis. In fact, it would, they wouldn't need external evaluators anymore if they were able to implement their own evaluation and monitoring framework. So we recommended that they implement that. But to support the implementation of an evaluation framework, we also know that services need really robust operating systems. So administrative, operation and governance systems need to be operating at a high level for services to be able to do the types of monitoring and evaluation that funders are now requesting that they do. It's very hard to get funding to take off frontline services to invest in operational systems, but part of our recommendation was to develop a plan to support, enhance their operational systems so they could would support them to do better quality assurance and monitoring evaluation more routinely in their program. So that's probably about it from me. I've given you lots of content. I might hand it back to you, Chris.
Thanks, Amanda. Okay, so we've got sort of a panel discussion with both Amanda, all 4 of us, Amanda, Nicole, Jill and Jill, which kind of provides a perspective from both the funder, the service provider, and the third-party evaluator, or more kind of advisor on how to do evaluation, which looks at this problem from these different perspectives. So please, if you have questions, anything to do with evaluation and how to do it well, challenges that you might experience, pop it in the chat or in the Q&A, and we can answer separately, but we'd love to ask your questions rather than my own, but I have prepared some earlier. So I might kick off, actually directing it back at you, Amanda. You as having worked with you for a few years now, you've kind of had you've got the perspective of working in a service, in a PHN, and as a third party consulting advisor. What do you see as what's the value of working with a third party, or what do you see as sort of that triad? How do you see that working effectively, or what's the point of doing it that way?
Well, I think it's helpful to get an external evaluator in to provide a gap that's happening in many services, that they don't have either the time or sometimes the capacity and skills to do their own monitoring and evaluation work. So what we've been able to do is provide guidance and support, targeted support, that helps people to be able to direct them into what's best practice, where to find the best data in what they've already got. But I think that the challenges are, in the discussion that I just had about recommendation 3, is having those robust systems in place to actually be able to do that monitoring and evaluation at a service provider level.
Thanks very much. So I just want to check, Jill Yearsley, are you on? She's actually out in Catherine at the moment. Oh, yep, there you go.
Yeah, I'm here. Thanks, Chris.
Hey, Jill. So Jill, can you maybe sort of outline some insights in your role as CEO at the Northern Territory PHN? What are the challenges around evaluation, and specifically with this project, how did you make the decision to prioritise doing this work with CAPS?
Thanks, Chris. That's a really good question. So I'll reference that with a little bit of my experience of working with Amanda and with Jill at CAPS. So when I first met with Jill, and obviously I was working with Amanda at the time, but Jill was very keen to share with me the journey that the organisation had been on in the development and implementation of this particular program, and how valuable it was for the community. I was aware that we were not funders of that program, but I was interested in the fact that it had been a program which had been funded for a number of years, and that the value proposition of that had not been fully explored by any agency. And indeed, it was, further being, considered, the funding models were being considered further, with no methodology around how you would evaluate the value and whether or not what we were moving towards would be of use to the community. So if I try and explain the reason why, from my perspective, from a PHN perspective, is that our responsibilities to the community and to the services that we commission, but also the outcomes that community members experience. So if we've got a program that's delivering outcomes which are of high value to the community, we need to be able to demonstrate that, to then begin the narrative and the conversation around the value proposition moving forward. I make that sounds a bit silly, but the concept is, if we really are in the situation where we've got a funding agency, it doesn't matter which one it is, who says we're going to review all of our funding and change the way we do things, how can we make decisions that are in the best interests of the community if we don't have the information available at hand to inform us of those decisions? Now, those funding agencies may still make that decision to go ahead and make whatever decision they're going to make. But as a sector, as a PHN, we have a responsibility to meet unmet need. So if by default that then leaves a situation where we have services which have been of high value to the community, provided high value outcomes, and of course we're hoping that this evaluation process will help demonstrate that, well, then we need to think about, well, what does that mean for us in our commissioning processes moving forward and our advocacy processes moving forward? And adding to what Amanda referenced regarding the external evaluation, of course, really, and absolutely right, I think, this should have been set up right from the get-go and would have informed the iteration of the project moving forward. As it is, though, I suspect, although I don't know, I'm sure Jill will be able to speak to this from CAPS, that as the organisation itself moved through that program, they would have been evaluating and reflecting upon the value that they were delivering to the consumer group there and there. I'm sure that they've done what they started with, and where they are now is quite different. So they will have naturally gone through that process. So what we're evaluating right now is not necessarily what was initially set up, but that doesn't mean it doesn't provide value. So I still think, you know, as an agency that's responsible for system engagement and system support, the responsibility of outcomes, actually, it doesn't matter who that sits with, but we are responsible to support service provision to the community members. I'm hoping that makes sense. Does that make sense? And the value of having someone like Amanda in this space is that she is now able to work with the provider, and of course will have been working with the provider as part of a role with PHN to support them around that, you know, data analysis, data extraction, and the kinds of outcomes we'll be looking to measure.
Jill, I might, just sort of stay with you for a moment. What, and because I mean, most of the people on this panel will be, all are working in PHNs and probably have, you know, similar challenges. When you're, you know, in commissioning a service or engaging with the service provider, what has been some of the insights you've had on how to have the conversation of the value of evaluation? Like, what have you, you know, and how do you overcome the challenges and maybe reticence or the lack of knowledge on how to do it? What has been some of the, you know, working in this space, the insights that you've gained to do that well?
I think it's about selling the why. Why do we need to evaluate? We're not here, it's not about criticizing, it's a quality improvement methodology. You know, health services or services which are focused on outcomes for people, human service focus, they're not in service delivery models to not get good outcomes for the people they're supporting and families. So it's about selling that why focus. Why is it important that we evaluate? Why is it that we important that we get an external evaluation? Why is this not something to be scared of? And instead something to be embraced in supporting us moving forward in the way that we can support community. And it's about sharing that as a journey rather than, it's not a compliance process. It's a quality improvement. It's you know, you're going in with a view of appreciative inquiry. It's having open-ended discussions with families and service users, but also with the providers of those services about their challenges, their risks and their opportunities, and demonstrating a space for real engagement. I guess one of the comments I go back to quite frequently in my own work with the sector and with our own portfolios, if you like, is, you know, we work in ENT, so we have what I would call, you know, thin markets, or we have markets where we don't have lots of competition. We have some, but not lots. So, but I would say that in many environments where we're looking at the service delivery models for families and people in this type of need, this priority group of need, there aren't actually huge amounts of services out there in many parts of Australia. There are in some, but in many parts of Australia, there aren't that many services available. And what most services would want to see are high quality outcomes, regardless of who delivers it. So I think it's about having more of that shared responsibility approach across the sector. It's not about that you're favouring one service over another. It's not about that you're prioritising one organisation over another. You're actually genuinely trying to achieve better outcomes for the community, which we're all responsible for working with. So it's that kind of conversation. So it's moving away, I suppose, from a compliance conversation and more into a quality improvement and outcomes focus. And outcomes are things that we haven't really embedded into a commissioning process particularly well as any kind of commissioners moving forward. And I was really interested in the example used in the introduction regarding the NHS and the outcome measures. And that's exactly where I think Australia will go to. But it's about how do we use that to support consumer choice and begin those quality improvement conversations. Does that answer your question?
There's something about an English accent and the sense of pride that comes when they talk about the NHS, I have to say. Yes, thank you very much. And Jill Smith, I'm curious of what like, why engage a sort of third party to do the evaluation as opposed to doing it internally? And what's your perspective on working with someone else to do this evaluation piece? What are the sort of some of the challenges and opportunities that come from that?
Well, I guess our two examples that Amanda has outlined, the first process was the youth services review. And for me, we had an option with that youth service after running it as it had been prescribed under the VSA Act for many years, and seeing the failures that were, for me, unthinkable in the community and with young people. We actually approached the department who were funding us and said, this isn't working, it shouldn't continue, we need to have a really good look at what we're doing, and engaged a consultant to have a look at the history of the program, where we were up to now and what we felt could be done better. It took us 18 months to actually come up with a model that we thought was workable. But in the process of that and seeking funding to actually do that and roll that out, there was no evaluation process built into it. And for me, it was really important to make sure that the why we were doing the changes that we were making was measured so that we knew whether we were actually making things better or worse. And were we actually absorbing more public money to do something that we thought was a great idea at the time, or is it actually going to make a difference and translate into better outcomes for young people, particularly young people from remote communities who often ended up in Darwin because they were using solvents and the community concerned about them. So for us, it was really about us seeking an advocate and someone who could support the evaluation, and it was a very modest evaluation as far as cost. We were really lucky that 360 took it up and were generous with their time. And out of that came some very clear messages for us around what we thought was a good idea at the time had a lot of merit, but we hadn't brought our staff team on board and we hadn't brought them along. And to use a coined phrase, that they hadn't drunk the Kool-Aid, and there'd also been some churn in our staff team as well, because some people who were there for the old iteration of the program didn't like the changes and didn't understand why they needed to be made. So there was quite a bit of upheaval in that process. But out of it, we've got a roadmap in the documents that Amanda was referring to, and around the program logic, and knowing that we know how to evaluate some aspects of our work already. We go through accreditation in a 3-year cycle, and we have to look at our continuous improvement constantly. But in the process of doing that, there are things that you have an unconscious bias about, so you may miss, and that's the value of having someone external. With the current evaluation process that's just commenced, it's a much bigger undertaking. It's a program that's been around a much longer time. And the last evaluation was done externally by Peter Dabbs in 1990. So historically, our organisation has always done family work, involved Aboriginal families and communities in the design of the work, and had not had an independent objective assessment of the outcomes for many years. We are about to go into a commissioning phase. We don't know whether NIAA will take up our program again. We felt that it was important to get this underway this year so that we had some more evidence of good practice potentially and great outcomes for client families, because we are quite a unique service in many ways. But it's also about benchmarking. So talking to colleagues who run similar services in the top end of Australia and other states, some of our issues around not being resourced for this work, not being resourced well enough to sometimes do things the way we'd like to see them rolled out because we're bound by the funding bucket. And that's why our board got on with PHN and co-commissioned this review, because we could see that to ask an external body who doesn't commission the work was a bit of a cheeky sort of an ask. Having really talked about how we could share that information that's gleaned from this with the sector was also important to us as a benchmark, but also to have a really good look at what we're doing and why we're doing it, because our obligation to community is similar to PHN in that we want to do the best for our clients. We want to do the best with the public purse. We know that we can't be wasteful, but we actually want to make sure we use the best opportunities to translate the good work into better outcomes for clients and community members, because our clients come from all over the territory and northern WA and Queensland. So given that we are a family-based service, they can all come in together, children and significant others. We have an opportunity to do some really holistic work with that entire family. And I think they're the things that get missed. People tend to put you in a bucket of drug and alcohol work or drug and alcohol rehab, but not look at the nuance of the work. So there's lots of reasons why we really wanted to have a look at this. And I guess we were lucky that we had a like-minded participant in Jill in the PHN that could see the value of getting involved with us as well. And Amanda obviously has had a relationship with CAPS as a commissioning body with PHN in the past. So we had an understanding of where we're both coming from. That's a very long-winded answer. I don't know if I answered your question precisely. Rain there.
No, that's fantastic. I think that what was coming up for me, and before I get into my own monologue, just so you all know, I'm about to open the window. So one of the requests that we had was an opportunity for people across the country to share their own experiences with the problems that we're talking about. So if you want to keep your video on or put it off, feel free. And just a quick side note, Marina, sorry, I answered your question. Jill Yearsley is actually out in Catherine, so doesn't have video capacity at the moment. And the other two screens are people on the 360 team. So you've got full vision of the panel, except for Jill, who we've got her great English voice. So I'll open that up in a second, but I'll just have one final question before I do. Building on your point, Jill, I was thinking it's kind of and thinking about the refunding of programs and how critical this, doing evaluation work is. Like when it's not embedded, it's so easy to defund it in terms of a kind of commission service. And whilst it, requires being more deliberate about efforts towards the program structure and the protocol, actually in the long term, it's so much better for the organization to do that work and to set it up. And so I actually wanted to ask you, Nicole, you've worked across the sector for, I think it's a decade now, is it? It's a
or 2 or 3, yeah.
How would you think about, you've been, seen everything across the sector. How would you think about the kind of investment, if you had to have a gut check on what investment you would make in a project into evaluation? How would you think about setting it up if you had to start a project from scratch? Like, what would be the thing, some sort of key insights or key tips that you provide to PHNs that as they are approaching commissioning a service to do something?
Yeah, that's a very good question. And there's no real answer to that. It's a bit of a how long is a piece of string kind of thing. So we've done quite light touch type evaluations where we've taken data, whatever data is available. Sometimes it's messier than we would like it to be, but we just kind of work with what we've got, and that's at the lower end, right up to pre and post kind of measurement and a much more detailed consultation process, a kind of co-design approach to the evaluation, to try and embed that into the service. So there's like quite a wide range of types of evaluation. The old rule of thumb used to be, I think, was kind of 5% of the budget of a project, but it's pretty hard to work that out when the budget of something is kind of ongoing and it's not a standalone type of thing. But I would just say it's really important to build something in any time. Like, it's never too late. We've done things where basically the project's finished and we're like back evaluating it to see whether it's going to continue to be funded. Ideally, build something in at the beginning, but it doesn't really, it's still of value anywhere along the line. But I think even starting with something would be, even a small kind of evaluation would be really helpful.
Great. So preferably a rope, but any kind of thread is, any kind of string is good.
Yeah.
Okay, so I'm going to now open it up, and hopefully we don't discover once that they don't want to see. So it's a trial run, but something that was requested by all of you. So Dabushka, I'm not sure what I need to do now to open up the platform to everyone. I'm sure you're working that out in the back end, furiously trying to know which button to pick. But whilst you're doing that, perhaps I might hand over to yourself, Amanda. Like, having kind of worked across this space, what do you think is, where have you seen evaluation done poorly?
Really? You're going to ask me that question. It's a matter of evaluations being done poorly. I think it's about evaluations being needed to be done and people needing to provide evidence that they're doing what they say they're doing, and not having the data on hand to be able to support that. So I think a lot is being asked of service providers in terms of justification for funding their work, which is reasonable given that it's public money, but having the systems and the capacity and the skills to support that work is the challenge. And I think the other key challenge is diverting funds from frontline services into backroom operations and evaluations. I think that's a really big challenge for commissioning services and funders, and it's also a big challenge for service providers who have a limited amount of funds and hugely vulnerable groups that have bucket loads of unmet needs, to divert and justify shifting funds out of frontline to backroom ops and admin systems and monitoring is a really hard call, and it's a real dilemma around monitoring and evaluation in my experience.
Totally. Look at this magical group of people. No, everyone's taken my advice and turned their cameras off. So please, we'd love to hear from you. Any comments, questions? There's a little raise hand button down the bottom. We'd love to hear from you. Yeah, over to you, Alan.
Hi all. Hi Nicole. Hi Chris. Seems like we're doing this every day. Sorry, I just wanted I just wanted to share what Adelaide PHN have been doing over the last probably 12 to 18 months. And that's that we have now incorporated into all of our contracts with our service providers the use of outcome measures. So the use of the ATOP is the mandated tool that we've decided, along with the K10 and K5 as well, but they're not mandatory. We've also, for people working with Aboriginal and Torres Strait Islander, services working with Aboriginal and Torres Strait Islander people, we've asked them to use the ADOM, which is a New Zealand tool, which is more sort of culturally appropriate than what the ATOP is, for working with diverse communities. And the other thing that we've also started doing in the last 6 to 9 months is working on an evaluation framework, recognising that as a PHN, if we're going to be asking our providers to sort of indicate what outcomes they're achieving and then we're wanting to evaluate them, we also need to have a basis and a framework for us to be able to do that as a commissioning funding body and to ensure that we're consistently applying that across the board. So there's been, I think, certainly from my perspective, having only been in the PHN for about 18 months, there was always a bit of a discord between and understanding what performance monitoring and evaluation were, and the two things are different, and that both are important components of what we as commissioners and funders need to do, but they have to apply different processes and tools to be able to achieve those. And I think the discussion about the evaluation, what does a baseline evaluation budget look like? And I think taking up Nicole's point, that 5% is something that we're certainly looking at. And one of the other things that we're starting to do going forward with our new contracts will be to build in an evaluation component into the budget. And we sort of have been thinking about the 5% as a starting point. So I just wanted to share that with everyone.
Thanks so much, Alan. It'd actually be interesting if people want. I mean, it's just a sort of, as Nicole said, a rule of thumb and like how long's a piece of string. But it'd be interesting for you to pop in the comment section, like what percentage you normally think about investing into evaluation. Next webinar, we're hoping to do a little polling function, so we might be able to get some data and share it with everyone as we go through around different content areas. Any other kind of questions or thoughts on how you approach evaluation in your respective PHNs? Would love to hear from some other people other than us, from yourselves. Feel free to just unmute yourself and have a yarn, or put your hand up, and I can go to you.
While everyone's thinking, Chris, I might just add to your question about poor evaluation.
Great.
Which I think, I'm not going to give an example of bad evaluation that's been done, but I think remembering, like, we need to remember as from the evaluation side, from the funding side, that service providers are service providers, they're not researchers, and they don't always have a sense of how to set up evaluation, and so they tend to do the best they can with what they've got that's required from them from the funder. And generally, if the measures are kind of clinically relevant, they're also going to be useful for an evaluation. So I think there's some of the things to think about when services are trying to put in place some ongoing measures like the ATOP or whatever. If it's a separate, we're saying, well, you have to measure these kind of things clinically to be clinically useful and monitor your clients, but we have this whole other set of things that we want you to do for funding purposes. One of those is going to drop off because clinicians are clinicians, they're not researchers or evaluators. So I think that's just something to keep in mind.
Awesome. Thanks, Nicole. So we have time for one final question. I think we've got Mr. Richard Cash with his hand up.
I just wanted to complicate that budget question and say a great evaluation should set up a monitoring plan to make it easier for service users to keep track of what they're doing. But one of those unseen costs is a data management system at the client end that's suitable for monitoring and getting good, easy tracking of those clinical measures that Nick was talking about before, that'll also output nice reports to be able to report on progress to something like a funder. And that's another common stumbling block. Well, I don't want to talk about an evaluation, but we can certainly talk about sort of fallow ground where it's really hard to start an evaluation when the system for inputting and then aggregating outcomes through something like a client record management system is underdone, undercooked.
Thank you, mate. Great. So that kind of takes us to time for the webinar. Alex just posted in a comment, also each service has their own definitions, criteria of information they are recording. That's right. Thanks for sharing that. Oh, sorry. So I think this last section was quite cool to share like across the community. So it's been really great to yeah, thanks for sharing your insights, Alan. And would love to keep this bit going. I think maybe have a bit more of this conversation across in the next session that we do. I want to really thank Jill Yeasley and Jill Smith for joining and sharing their perspectives. Thank you so much for coming on. Jill, you've been away for a month and just came back on work today, so I appreciate the challenge of this. And Jill Yeasley, you're out in on the ground in Catherine, so thank you so much for joining as well. And I also really want to acknowledge Amanda and Nicole, Richard, and the team for bringing this together from 360 Edge, and each of you for all joining today, because yeah, it's been amazing. We had over 40 people from PHNs across the country with different perspectives coming on board, and I think yeah, it's acknowledgement of you guys for joining, so thank you so much. So we've got a survey going out. The most important thing, obviously feedback on how we can improve is really important, but we really love doing this and having this conversation. So if you have ideas or challenges that you're experiencing, we'd love to bring them to the fore and perhaps share and learn from each other on how to do this work really well. So that should be in your inbox, or feel free to send me or anyone on our team a message on if you have an idea around that. Otherwise, we will see you at the next one. Thank you so much.